welcome everyone to our second session of the Superior Health implementing a self-measured blood pressure or SMBP program in your clinic setting. As I said, this is session 2, and it's about starting your SMBP program. Next slide, please. Before we get into the nitty-gritty of everything, I just want to do a few little housekeeping details like we always do at the start, right? So all of these sessions are recorded. We will send you an email after each session with the link to the recording as soon as it's available. Also, we will provide you with a link to the slides each month, and then as part of the work that we're doing, we want to make sure that we remind you of we do have homework or action items for each session. So about a couple days before each session, we're going to just kind of remind you of what that is. So in case you have time that you can work on that. Another thing, we love to see all of your gorgeous faces. So if you can turn on your cameras, we really appreciate it. I know sometimes with bandwidth that doesn't work the best, but if you can turn on your cameras, that'd be great. And just a reminder too, to put yourself on mute unless you're speaking. We do want these sessions to be interactive. So please, if you do have a question or a comment, feel free to jump in. You just need to unmute yourself. And we're asking if, when you do that too, to just kind of state your name and where you're from so that we have that information too. So we're going to get started here today. I know we kind of did this last month too, but for our introductions, as we said, we had action planning or homework from last month. And those questions were, who are your clinic champions? And who are you targeting, or what patients are you targeting for your SMBP program? And are you able to pull a list of those patients? So for our welcome today, we just like each of you will just kind of go around the room, the virtual room, and have you say your name, your title, your organization and location, and then if you were able to answer those round robin questions, if you could tell us how that went. So just quickly, I'm just going to introduce myself again. My name is Jerry Henniker. I am a Quality Improvement Advisor with Superior Health Quality Alliance, and then I am located in Minnesota. And Carrie and Andrea, do you want to introduce yourselves?
Sure, I can go next. My name is Carrie Finley, and I'm a project specialist with the Superior Health Quality Alliance, and I'm based out of a little bit north of Madison, Wisconsin, and my background is in nursing. Andrea?
Yep. Hi, everybody. My name is Andrea Boucher. I am a Quality Improvement Advisor with Superior Health Quality Alliance, and I'm based near Metro Detroit, Michigan.
And then Tina, it looks like you are first up that I can see on my, lucky, you feel lucky, don't you, Tina? You're the first one I see. Oh, Tina, we can't hear you.
Can you hear me now?
Yes, I can.
Okay. I was going to try to use my headset because I've got some noisy dogs in the house here, but apparently that wasn't working for me this morning. But good morning, everyone. My name is Tina Schrader. I'm a registered nurse in our Quality Innovation Department at Inclusa, located in Wisconsin. Our clinical champions for the blood pressure self-monitoring program are myself, Stacy Maves, and Trisha Mayak, all with Inclusa. And who we are targeting for our self-management blood pressure program are our frail elder members throughout the state of Wisconsin who have a blood pressure that meets the criterion of stage 2 hypertension, that being equal to or above 140 and or equal to and above 90 diastolic. And we are able to pull a list of those patients. We are focusing on, well, we call them members. We're focusing on members who live in their own or in the community and not in a residential or institutional type setting where they are more likely to have support and more likely to need education and support to do a self-monitoring of blood pressure intervention. So that's in a brief nutshell, as I realize there are a lot of us on the call, but that is who we are targeting.
Thank you. Thank you, Tina. Great information. Trisha, looks like I see you up next.
Okay, can you hear me?
Yep, we can hear you fine.
Okay, I'm not sure if it's coming through my headset or the computer right now, to be honest, but Trisha Mayak, also with Inclusa, as Tina mentioned, so indicated as one of the clinic champions. My background is in nursing, but my title is Director of Quality Innovation. So we really focus on all things prevention and wellness. You said Inclusa already, so Stevens Point is my location, so I'm in the central Wisconsin area.
Great.
Thank you.
Christine Gurney, you're up next, or who I see next on my screen.
Hi, can you hear me okay?
Yes, I can hear you. Thank you.
Wonderful. So I'm a registered nurse and I'm in Southwest Montana in a town Dillon, working for Barrett Healthcare Clinic. I serve as the population health coordinator here, and we would have our patients who meet chronic care management criteria, generally, or primary care management, and they are usually referred to us by their primary care provider unless we happen to identify something, but usually the provider identifies them and sends them to us for remote patient monitoring.
Great. Thank you, Christine. Patty, I see you next on my screen.
So good afternoon, everyone. My name is Patty Burchett, and I am a quality consultant with Improve Health, and I am located in Kalamazoo, Michigan. And so I'm not a part of a clinic. I am just really here to learn more about the training itself for SMBP. So looking forward to the learning opportunity.
Great, great. Anne, I see you up next. Can you hear us, Anne? And Anne, if you aren't able to unmute yourself, if you want to just put in chat, if you were able to do the homework, that's fine too. Where to go to the next? Mary Enright, that's who I see up next.
Hi, I am actually homesick, so if my voice starts to give up, I won't be able to offer much more today. I work at Winona Health, Southeastern Minnesota, and I'm a registered nurse and the quality coordinator. Our workflow expert related to our blood pressure initiatives was unable to attend. I didn't see her on here. And we are similar to Patty, just trying to learn a little bit more about it. We've recently purchased 24-hour blood pressure monitors, as well as some digital monitors to give to our patients. And I think we're going to focus on our care coordination, hypertensive patients, but that hasn't been fully decided yet. So I'm anxious to hear about the work going on for others.
Great, thank you. And you know, the thing is too, I don't want to put anybody on the spot too with these were just our questions, are things that we wanted to kind of help you get started thinking about your program. So if you weren't able to do, you know, identify champions or who you're going to identify for patients, that's what this program is about, to help you do that work, because we'll actually delve into this a bit more today. So Nevin, you're next up on who I'm seeing on my list. Are you there? And hopefully I said the name right. And if you aren't able to come off mute again, you can just put your answer. I think it was Anne and Nevin. If you just want to put your answers in chat, you know, or, you know, your name and where you're from, that'd be great, so that everybody knows who everybody else is. Did I miss anybody else? If not, I think we can get started here. Carrie, next slide, please. And this next slide is just really a reminder of our collaborative schedule. So this was a 6-month program. Our first session was in January, and this February 14th is our second session. And then you see the schedule here for the remainder of the 6 months. So we'll be wrapping this up in June. And all of our sessions are from 11:30 to 12:30 Central, and then 12:30 to 1:30. Eastern. And when you signed up, these should have all shown up on your calendars. You should have registered automatically for all of them. So next slide, please. And here's our objectives for today. We're going to establish care team roles. So kind of review who your care team members can be and would work best for your program. Identify actions to take before you start your SMBP program. And then we're going to go through just a few clinical support examples. Next slide, please. And we're going to start here with a few polling questions like we did last time. And let me just pull up the first polling question. Hopefully everybody can see it. So our first question is, are patients without a confirmed diagnosis of hypertension eligible to participate in an SMBP program? And so answers are yes, no, or unsure. I'll give you all just a little bit of time to get your answers in there. So I think we have just a few, looks like we've got 4 of you, but a few more of you want to answer before we close the poll. And these are things that we'll cover today too during our sessions. So we're just kind of seeing where people are with their programs with these polling questions. I'm going to end the poll here. And can everybody see the results? So 80% of you said that yes, they can be part of a SMBP program. And then we've got 20% said unsure, which is great. You know, that people are, you know, this is what we're here to teach you about, right? So you're right. You do not have to have the answer is that you do not have to have a confirmed diagnosis of hypertension to be part of an SMBP program. A lot of times that's why when you set up your program, you look at who you're going to target. Are you going to only target those with high blood pressure? Or are you going to look at some of those other things, such as those who may have masked hypertension? And we'll talk more about that today too. Okay. And there we go. And then I'm going to pull up our next polling question here. And this second polling question is, what method or methods can be used to obtain patient SMBP readings? So when your patient is doing their readings at home, what ways can you use to get that information back from the patients? So they can call it to you via telephone. They can use a secure fax, an online patient portals such as MyChart or a telemedicine website. Also, maybe you just are having them coming in for follow-up visits. So let you all have a little time here to answer. I think we've got almost everybody answering. So I'll share the results here. So the majority of you said all of the above, and that is, you know, the answer that we've been told by the experts, right? So that yes, they can use all of those methods to share their SMBP results. So thank you everybody for taking the time to do those. Okay, next slide, please. We're going to start talking now about the different roles or care team roles for your SMBP team members. Next slide. On this slide, it's kind of a visual, and we do have the link at the bottom of the slide too, where you can find this information. So this is a visual, a big overview, and it comes from the National Association of Community Health Centers and it's from their SMBP Monitoring Implementation Guide, which is a great resource. So that's why we did put that at the bottom of the slide. And it just really kind of gives you that snapshot of what different team members' roles can be. So it breaks it down into those team members who are licensed, you know, such as a physician or a registered nurse or a nurse practitioner, the roles that they play in the team. And then what the non-licensed staff in your facility can do. And then also we have a section that talks about what are the patient's responsibilities. You know, the patient is part of this team too. They have responsibilities too. So that's also on here. And we'll go into each of these a little bit more on upcoming slides, but this is just kind of a nice little snapshot to look at all in one place. Next slide, please. So breaking it down by position, and I realize that not everybody is going to have all of these positions on their team. This, you know, ideally, if you could have everything that we go through, that'd be great, but we know that that's not always the case. But if you do, this is the roles they can play. So for a medical assistant, and the one thing too that we really encourage for all your team members is that they're working to the full, their fullest ability. So working to, you know, whatever they're sort of, if they're a medical assistant or a registered nurse, that they're working at the top of their licensure. So that's what we kind of want to get at with this program. So for medical assistants, you know, they can measure and record blood pressure. They also can talk with the patients. You know, if the patient is coming in for that check and they're bringing their blood pressures into the medical assistant, you know, they can share patient, you know, information with the patients, provide them with instructions as authorized by the physician who's leading the program. And then also they can do that non-triage communication with the patients. So again, use your medical assistants to the top of their, you know, certification to be part of this program. If you have community health workers as part of your team, I think this is kind of a really great go-between or liaison for the patients. You know, they're there to coach the patients, just kind of what their role of community health workers are, right? They empower the patients. They provide that social support. They can help them with their goal setting. Also, they're a good one to use if you're seeing that maybe the patient isn't improving, or maybe they're not even doing the blood pressures at home like they're supposed to, you know, use that community health worker to help identify those barriers. Why is it that the patient isn't able to do that, or that they aren't doing that? Sometimes a patient might be more willing to open up to the community health worker about that. As I said before, they can be that liaison for the patient with the clinical care team and also with the care coordination team in your facility. And they can also engage your patients in preventive care, you know, talk about chronic disease management. Again, identifying those barriers that they're maybe having to managing their hypertension. Maybe it's not getting enough activity, or maybe it's not, you know, having the availability of healthy foods. You know, maybe they only eat fast food. Why is that? So that community health worker can kind of help you dig into that a little bit more. Next slide, please. Registered nurses, of course, they're there too to, you know, measure and record the blood pressures of the patients who are part of the program. Also, they can teach, or they should be the ones teaching the patients and the families, not only about taking the blood pressure, but also about any prevention that they can do, how they can, you know, better manage their hypertension at home. They can administer medications or treatments as prescribed by, you know, the physician or the nurse practitioner. They can be part of that work with the patient. And then they are the ones who help deliver and coordinate that care plan. And they work with all the members of that healthcare team that's on this SMBP team. Also, billing team is a very important part of this program. I don't think they were on that first little snapshot picture that we had for you, but the billing team is really there because this is a billable practice for your clinics. They're there to help you understand the billing codes, the CPT codes, so that you can be reimbursed. Next slide, please. And then also, if you have a pharmacist on your team, they're there, they can really help with the support as far as making sure the medications are available and consistent with what the providers have prescribed. They can also do patient education as authorized by the state laws that they're, whatever state they're in. They can do medication review with the patients, and also I think kind of even work in consultation, as it says on the next bullet, with the healthcare team. So maybe, again, we're prescribing medications and we're finding that the blood pressure through this, you know, patients taking their blood pressures at home or finding that the blood pressure isn't being controlled. Maybe it's a different med that needs to be used. The pharmacist comes in real handy for that. The other thing too is just even being aware sometimes, and this might be something that the registered nurse or medical assistants or community health worker can even help you find out. A lot of times we have all their, prescribed medications, but we might have patients who are taking things at home that they're not even thinking about, that are affecting, over-the-counter meds that are affecting their blood pressure. So kind of that's another way with the medication review with the patients that the pharmacist can help with. Maybe they're taking a lot of some type of pain. Sometimes we know like ibuprofen or Aleve sometimes, elevates blood pressure. Maybe they're taking a lot of that for some type of pain that they've never really said because it's over the counter, or some type of herb that's doing, is also affecting their blood pressure. So I think that's an important role that the pharmacists can play. And then they also can provide the medication therapy management services. And as you see here on the side, we've got a few bullet points talking specifically about medication therapy services. And it's talking about not only about the monitoring the use of medications, but also device usage. And as we'll talk more in upcoming sessions, the blood pressure, device is part of that, that code. Next slide, please. And here we just have a number of resources listed about the scope of practice for each of these different positions that we've been talking about. Where we could find them, we have them listed by state, or at least we have like the national scope of practice. So you see for the medical assistants, we have, listed by the different states, and we also have a national resource. Community health workers, we have the resource from the National Association of Community Health Workers. Next slide, please. And then on this next slide, we do have for the registered nurses from each state, and then pharmacists is a national scope of practice along with one from Wisconsin. All of these links on these past two slides are clickable links. So you can, and you might be able to even find more, but we put out here what we could find that kind of pertain to our 3 states of Minnesota, Michigan, and Wisconsin. So next slide, please. And I should just take a second too. If there are any questions, you can just, either take yourself off mute, or if you have any questions, you can also just put it in the chat. So I just thought I'd maybe stop for a second to see if anybody had any questions over what we just covered. Okay. And if you want to go just to the next slide, then Carrie. So, and again, put any slides in chat too, as if you think of them, if that's easier, that's fine. So getting started with your SMBP program. So things that you want to have in place as you're pulling your program together, and things to think about. And I know some of you already have a program in place, so you're looking at ways to kind of tweak it, or maybe make changes or make it better. So it's always, I think when we talk about anything that we're launching, be it in a clinic or a hospital or any healthcare setting, it's always, you want to have that one provider on the care team who's the champion. Who's the person who's, going to champion this project, especially with your, maybe your CEOs or the admins, the C-suite, so that you can get the funding or the staff that you need for it. So who is that champion going to be? It could be a physician, but maybe it's a nurse, or maybe the medical assistant is the person who's championing this project. But just make sure you have that champion for your project. And this person is the one who's really there not only to make sure the project, keeps going, but also is there to make sure you have everything in place so that others can learn about the program, and also to help train others. You also want to make sure you allocate appropriate time for the work you're doing. In this snapshot here, when we talk about training patients on SMBP, I know it says 5 to 6 minutes per patient here, and I think this is a little low. This is talking about when you're kind of doing that one-to-one after you've done that initial training with the patient. So we're talking about if they're coming into the clinic to give you their here's my results for the last week, and you're checking in. I mean, make sure you're allowing like another 5 minutes or so each time when they come in, or maybe you're doing as a telehealth visit to just kind of, review with them that they're the process that they're using. So we're going to talk more in our sessions 3 and 4 about the actual training of the patient on how to take the blood pressure, how to make sure you have the right cuff and all that. So that's a more extensive process than the 5 to 6 minutes we have noted here, just so you know that. Also, you want to make sure too that the device is accurate. Again, we'll talk about how you do that in some upcoming sessions, but again, allowing time for that, and that's 5 minutes. You need to have time to average and document the readings the patient has given to you. That's like another 5 minutes. And then also, if you're doing a loaner program, you're going to have have extra time there, because there's information that there's things you need to do as far as disinfection and strategies for your loaner program. And that will be covered more in session 3. So you can see each time when you're checking in with the patient that you need to allow like a good 15-20 minutes when you're meeting and going over things with them. Next slide, please. Other things to think about when you're designing your process for your SMBP program. So really questions that you want to answer as you're designing your program. So everybody's program is probably going to look a little different. So that's why we put it, these are things you should consider, because it all depends upon who the team members are for your program, what patients that you are going to target, and just how things are set up, whether you're doing a loaner or whether people are going to purchase their cuffs or people are going to, buy their own cuffs elsewhere. Maybe you have the cuffs there for them to purchase, how it's all going to work. So first you want to, how are you going to identify your candidates for SMBP? And I know a couple of you were talking about, which patients you would already identify that you want to be part of your SMBP program. But, this might involve looking at, okay, here's all of our patients with hypertension, maybe don't want to take everybody who has hypertension. Maybe it's those, frail elderly, as I think one of you said, or maybe you want to start with identifying patients who have masked hypertension. It's, kind of identifying what group of patients you want to use for your SMBP program. Who's going to be the person who trains the patients to do the self-measurement? And maybe you have 2 different people who are doing that. But again, if you're having 2 people do it, you got to make sure they're consistent in the training. But who's going to be that person who trains the patients? How are you going to get the readings back? It could be maybe the patients, are they going to bring back the readings? Are they going to use blood pressure, just playing little blood pressure cards and record it on that and bring those back? Or is it going to be something you can get off the device? Do you need to have an appointment for that? Does a patient need to come in to have that done, or can they do it via a telehealth visit, or can they send it to you via MyChart, which is a patient portal, and who's going to get that information? So kind of think through those logistics. Who's going to be the person who's responsible for when they get those numbers that they're going to, that they're going to average, do the averaging, the documenting, and then also notifying the physician of that average. And what is that follow-up going to be? So, if somebody's blood pressures aren't coming down or maybe getting higher, so what's the follow-up? Does the physician follow up with them, or do they schedule an appointment, have the patient come in? Maybe the pharmacist is involved too, because we need to identify different medications. So just kind of, those are some of the questions to ask yourself as you're setting up your program. Next slide, please. And just a few things, if you're doing a loaner program, who's going to be the person who tracks the distribution and then return of the devices? Who's going to be responsible for disinfecting the returned loaner devices, and where are you going to store them in your facility? And again, the upcoming sessions, we'll talk much more about different devices that you can use in your program, different blood pressure devices, how you can obtain them, and how to set up a loaner program. So next slide, please. Here's a little bit more, talking a little bit more about identifying those patients who are eligible for the SMBP program. So just a few things to think about. If you're going to look at patients with a confirmed hypertension diagnosis, these might be patients that you want to encourage to get their own validated SMBP device versus maybe doing a loaner program with them, because if they have, documented high blood pressure, it might be something that they want to have a blood pressure cuff so that even after they're part of this program, they can continue to monitor their blood pressure. And again, if a patient can't afford their own device, then you can set up a loaner program, or sometimes there are different companies who provide blood pressure devices to clinics for SMBP programs. And then the two patient types that don't have a confirmed diagnosis of hypertension that you might want to put in the program because they're at risk would be those with masked hypertension. And those are the patients who, when they come into the clinic, their blood pressure is always normal, but they're showing different signs of hypertension. So you're thinking they have hypertension, it's just not showing up when they're in the clinic. And then the white coat hypertensive patients, those of course are the ones who come into the clinic with high blood pressure readings, but they, don't really have hypertension. They just, as it's called, white coats, they get there, they probably ran up the stairs and are anxious about being there. So they always have high blood pressure when they're in the clinics. And the other big point here is the patients have to be willing to measure their blood pressure at home. So if, you've confirmed they have hypertension and they meet one of these criteria that you're doing, but they're like, I'm not going to measure my blood pressure at home. Or even if they say they're going to, but you don't think they're going to, they probably aren't a good candidate for this program. Next slide, please. Here are just a few different methods that you can use. So the patients, got their blood pressure cuff, they've been instructed on how to take their blood pressure at home. They're doing the blood pressure reading. So ways, how are you going to get that information back is kind of what we talked about. So there's a couple of different ways you can do it. Are they going to call you up on the phone and leave a phone message or talk to somebody in the clinic and give you their numbers? Are they going to send them in by secure fax? I'm not sure anybody uses that anymore, but that is an option. Online, maybe you're going to use the patient portal. And I always refer to MyChart because that's what I'm familiar with through Epic. But, there could be a way with different electronic health records to, give you that information via the patient portal, or maybe there's also a telemedicine website you use, or do you want to do follow-up visits? Now, again, these don't have to be in-person visits. It could be a virtual visit with the patient, but, in this case, maybe the patient has been, just writing in on a tracker card. Sometimes too, some of the different blood pressure devices out there you can just download the information. They've got a history of the blood pressures, so you can download it that way. So there's a couple of different methods that you can do. And some of it is, what works for the patient. You'll have to kind of talk with them about what would work best with them. And then again, just remember, you have to average the readings by the patient into one single systolic or diastolic blood pressure. Next slide, please. So again, if the patient's doing the recordings at home, just a few different things that you can use for tracking resources. There are blood pressure tracking cards. Actually, we can send this out in an email after. I know the American Heart Association has some great examples of tracker cards that you can use. Also the patient portal, again, just that's a great tracking resource that you can set up through your MyChart, or I keep saying MyChart, but through the patient portal. And then there might be other apps that are available, and especially with some of the different blood pressure devices. And next slide, please. Here's just a quick example of an SMBP workflow. So as you can see here, it starts with identifying those patients who would benefit from performing SMBP. So we've talked about that here today, and we'll talk more about it in the next few slides. In upcoming sessions, we're going to talk about training your staff on SMBP, the techniques to use, and then we'll have some competency checklists that you can go through to make sure that the staff are trained to do the blood pressures, and then they'll train the patients on how to do the blood pressure. Also, we'll go through different SMBP devices in upcoming sessions. And then Next in the workflow, of course, is when you're getting that data back from the patients, and then you would want to average those results, and then take any action from whatever the results are. Maybe everything's great and it's like, it's just status quo, keep taking your blood pressure. But again, maybe there needs to be a change in medication, or maybe the patient just needs to make some more lifestyle changes, such as diet or exercise. We'll talk a little bit more in upcoming sessions about loaner programs and calibrating of the SMBP devices, and making sure that their device works properly or fits properly for them. So this is just kind of an example workflow. And next slide, please. Here's a slide just talking about looking at the different patient readings, or interpreting the patient's readings. And this comes from the American Heart Target Blood Pressure Program. And this is where it will help you identify maybe what patients to be part of the SMBP program. So, we see these first two categories. If their blood pressure is less than 120 or over 80, it's normal, probably not going to have them in an SMBP program. And really, it's if you're using to identify your patients, I don't know if you use registries for hypertension, or if that's something you can pull easily from your EHR. I'm guessing the easiest way that you're going to have to identify those patients are those who have been coded as a patient with hypertension. So, I'm not sure if the patients who have elevated blood pressures are always going to show up easily in your coding to pull that patient list. I think one of you said that you already have pulled a patient list, and I don't know if you want to share in chat how you identified those patients that you wanted to have part of your program. The ones that we have talked about already is those with like the MAST or the white coat syndrome. Those might be great patients to be part of an SMBP program, especially the MAST hypertension, because those are the ones that are probably at greatest risk because they're not being managed for their hypertension, because they're not always being identified in their visits when they come in. And then, of course, those patients with a sustained hypertension of greater than 130 over 80, excuse me, those are patients that, maybe they're already doing lifestyle changes or medications, but we're still not getting their blood pressure under control. So being part of the SMB program could be helpful for them. Next slide, please. So once you're working with the patients, they're getting their blood pressures, and then they're bringing their blood pressures back in, right? So there's a number of different ways you can provide, feedback for the patients, because we do know that patients who are part of SMBP programs, are associated with having better blood pressure control, as long as they also have that additional clinic support. So it's not just about them taking their blood pressures at home, right? So different ways that you can provide that feedback. It's kind of, we've talked about how they can share the information with you, but also how you can share the information back with them. So again, maybe it's using a web-based feedback, or maybe they're calling in if that's what they're comfortable doing. Maybe it's a one-to-one visit, either be a, like a Zoom visit or a telehealth visit, or maybe this patient prefers to come into the clinic and talk to you. So there's a number of different ways that you can do it. Again, looking at what works well for the patient and what you can do well in your clinical setting. And then talking a little bit too about that last bullet point, talking about the behavioral health management teams. I mean, these are also really helpful in educating patients and helping them focusing on improving their hypertension management. And again, it covers topics, such as, increasing activity, or it's diet, or stress management, or maybe it's even, tobacco cessation, because all of that, we're talking about controlling hypertension, but, if they're, a smoker or use tobacco, that might be more of what they need versus some of the other activities or parts of behavioral health management. Next slide, please. And now to talk a little bit more about some clinical support examples. Next slide, please. And this is just, again, a quick snapshot of kind of, nice. People learn differently, right? So it's like sometimes seeing these, some people like to look at bullet points, some people like to look at pictures, right? So this is just supports, the evidence of a self-measured blood pressure program. So along with taking the blood pressures, you have that clinical support. It helps reduce hypertension and death rates due to hypertension. So there's a number of different, clinical support aspects noted here. Next slide, please. And then here we have, this is actually from the self-measured blood pressure, the link, self-measured blood pressure monitoring group, and the link there is listed in. And it just shows again that because self-measured blood pressure really relies as much on the patient and the care team, and they both have to work at it, right? It's not just one. They both have to be working together to help lower the patient's blood pressure. And so there's a lot of key steps to help you identify, and they're all kind of listed in this graph here, to help you identify, engage, and prepare and support your patients in using SMBP, and also different ways here to equip the care teams so that they can leverage that information and provide better and more timely support to those patients. So it's just, again, kind of captured here in a picture that kind of shows how everything is, it's got that, you start with the pre-visit planning, the patient goes home, you get outreach, they use the data to make care decisions, and then it's back to, talking with the patient again and them going back home and doing the SMBP at home. So a lot of it is that kind of PDSA cycle. Next slide, please. And when we talk about just the one-to-one counseling too, it can be with any member of the care team. So maybe the patient has an issue that's more related to lifestyle management. So maybe that time they're talking more with the community health worker or the registered nurse, or maybe it's more about their medications. So then they meet with the pharmacist. So I think it's really, when we talked about the one-to-one counseling, it might not always be the same person. I think it really needs to be focused on what the issue is that the patient is seeing when they come in for that meeting. And as you see here, nurses can provide telephone-based education, but you can also do small group classes if that's something. There are patients who prefer to learn in a group setting, so that might be something too that you want to set up as part of your SMBP program. Next slide, please. And here again, just talking a little bit more about some of the different clinical support examples. They can be web-based, computer, you can use secure patient websites. And then also maybe you do text or email reminders too, maybe that's something the patient needs, is a reminder to take their blood pressures, or the reminder to send in their blood pressure readings through the patient portal. So just making sure, of course, that it's a secure communication method that you're using. And next slide, please. We're going to talk just a bit here about sustainability. Next slide. And there's just a number of things that go into the sustainability. And I don't want to say if you don't have all of these things, you're not going to be able to sustain your program. It does really help, though, to have all of these working together. So having that SMBP champion, making sure you've identified the appropriate patients to be part of your SMBP program, having the resources. So we're talking both about staff resources, so making sure you've got the staff there to support the program, and that they also have the time, and that they also have the physical resources such as the SMBP, the blood pressure cuffs, and maybe a patient portal is set up, those type of resources. If you're going to use a loaner program, how that's going to work. Also checking into the insurance coverage for these at-home devices. So, be it Medicare, or if you're setting this up for other insurances, what kind of support and what do you have to do for coding to get reimbursed for that, which relates into the billing and reimbursement point. Next slide, please. And I want to check and see if there's any questions first, and then we'll talk about the action planning for our next session next month. So Any questions? I know, Tricia, I see you pop something in chat here about, because I'd asked how you determined your members. And so you've got a link there and you said to determine the members in your project, you chose to enclose those who fall into the stage 2 value, which is greater than 140 over 90. Great. From that, can I ask, go ahead, Tricia.
Well, no, you ask your question. That it might be what I was going to answer, but go ahead.
Well, I was just going to, because my question was, so are you including all the patients that fall into that category, or did you then whittle it down from that, from what that came into too?
Sure. So we did whittle it down more. So first we just looked at our entire population, what was kind of going on. So earlier Tina mentioned our frail elder is where the majority we were seeing. We have target groups for our members for them to be functionally eligible in our program. They fall in a target group. So that was that determination. We also chose to focus on those that live within the community on their own versus like in a residential, because we're making an assumption that they have a built-in support for some of that already, or those needs should already be being met by somebody. Where if they're in their own place, it probably is really our care teams that are supporting them in that. So frail elder, living on their own. And then because we have certain criteria for our projects that we need to meet, our sampling then is coming into our members who we know will have an assessment coming up in the months of June, July, and August. So while we're looking at we looked at all members to find out where our greatest impact is occurring. We did sample it down just so we could move through the project in the timeframes that we needed to.
That sounds great. So for others on the program, and I know everybody's kind of at different stages too. Some are just starting, some already have a program. I'm just wondering if others have kind of this session today, if it kind of helped you think about who you want to target or forming your team. Others have any thoughts on how they're going to target who the patients for the SMBP program that they want to share? You can put it in chat or you can just come off mute too. I'm really curious about, has anybody done any work in their SMBP programs or thought about this for their SMBP programs, identifying those patients with either, especially the masked hypertension ones, because again, those are maybe not as easy to pull out of your charts, because if their blood pressure isn't appearing to be elevated on their visits, I'm just wondering if anybody's looked into having those patients as part of their programs. And something to think about too.
I wouldn't say that we were, obviously we were not targeting that specifically for our project, but I think that for us, as we're hoping to provide our colleagues with the tools to support the members, that them having the information as resources to use, they can use it with really any member that they feel is appropriate, and not just because we said this member's in the project. So meaning all of our members get assessed, and if they assess that there's signs of hypertension but yet no diagnosis, our nurses should be following through to address that need in the member. And that may mean that they choose to encourage, right, like self-monitoring, and then do some education with them. So not specific to our group that we identified, but we're hoping that the tools that we share will be beneficial.
That's a great point, Tricia, because maybe as you start, you're going to have a specific group you have targeted, but I like that point that the nurses or whoever, it could be your medical assistants, can identify those patients who maybe they don't fit that specific criteria, but yet they might be a good candidate for the project. And also I see from Christine, patients are usually identified by their primary care provider, and they run this through the care management program. And you also receive a list from your ACO who notes the high-risk patients. I think that's a great point. So there's a number of different ways you can get the information for the patients you want to target. So I see we're about 20 after here. I want to get to the action planning. So our work for our next session, which will be on March 14th. If you want to go to the next slide, Carrie. So our next steps, things to think about for our next session. I really hate using the term homework, but just to kind of keep you moving with, you know, how you're putting your self-measured blood pressure program together. So how will you get the self-measured blood pressure readings back from the patients you've identified? So we covered a number of different ways that you can do that today. So thinking about how you're going to do that. Who is going to be the team member that is going to be responsible for the averaging, documenting, and notifying the physician of the SMBP averages, and then how you provide that feedback to the patient. So what is, you know, you've given that, you know, information, of course, to the provider, but who's going to, you know, what are going to be the next steps? How are you going to, you know, take those next steps with the patient? And next slide, please. And also to get you starting to think about if you want to do first, are you going to have a loaner program? And then so who's going to, if you do a loaner program, who's going to track and distribute and return the devices? How are you going to get those devices back? Who's going to be responsible for disinfecting the return loaner devices? And then who's going to do the storage of those? So kind of start thinking about that. And we're going to cover a lot of this information too, you know, into more detail, but just kind of have you start thinking about those roles. Check, are there any questions or comments or feedback that people have about today's session? Things you'd like to share? I should just check too, and with Carrie and Andrea, anything that we missed in our presentation today that we should share with the group?
I think you pretty much covered it, Gary, but I am just about to put a link to the action planning document so you can have all the questions from each week. You'll have that available to you. So I will drop that link in the chat.
That way you guys can work ahead too, if you want to start, you know, because some of you, like I said, I know you're at different points with your programs. So if there are things you want to start working on ahead of time, that's fine too. And then again, we'll also share the slides from today and a link to the recording. The recording probably is not going to be available for like another week or so. It takes a little while to get all that information. And then there'll be an evaluation link that Andrea puts in. I just want to cover just a few. If you want to go to the next slide, please, Carrie. We've also formed a group on Superior Health Connect. So if you haven't already joined Connect, here's the link where you can join. And so this is a private group on Connect where you guys can talk amongst yourself. I don't want to say it's like Facebook, but because I'm not even on Facebook, so I couldn't even tell you. That's a bad comparison on my part. But it is a spot where the people on this call can just talk. You know, maybe you tried something in your clinic and you want to get feedback from somebody else who's already, you know, like, did you do, this is how we identified our patients. Is there a better way to do it? Or as we get further into the loaner programs or the different roles for your staff, this is a place. So if you click on that link, you can join that group, and we highly encourage you to be part of that. And then plus there's other things on Connect besides the SMBP program group. And there's a lot of great information out there on Connect where you can connect with other people who are part of the Superior Health group. And so we talk about chronic disease, we talk about infection prevention, we talk about hospital work, we talk about clinic work. So it's just a great site if you haven't already joined. Next slide, please. Also, just want to make you aware too of our Back to Baseline and Beyond. These are chronic disease management webinars that we do monthly next week, actually on Tuesday, and it's at 12 noon Central. And then again, we do the same session at 3:30 Central. We're talking about motivational interviewing. I know a lot of people have asked about that. So that session will be next week, and we'll give some specific examples and send out scripts afterwards to kind of help you talk with your patients. Why we won't be doing a specific example on hypertension. A lot of what we talk about are things that you could use with your patients with hypertension. And then we'll, as you can see, upcoming sessions are on cardiac rehab. We're going to talk about the year in review in April, and then also about in May, we're going to talk about the importance of hypertension control and stroke awareness. And next slide, please. Another great group on Connect, and the link is right there for you to join, is the Food is Medicine group. And this really great for hypertension control. Again, when we talk about, talking to patients about lifestyle changes, food is can be a major part of that. So this, the Food is Medicine section, it talks about how nutrition impacts our health and how it plays a major role in chronic diseases such as, hypertension, diabetes, and heart disease and kidney disease. So really, we're looking at how we can increase people's knowledge about using food to help them with their manage their chronic conditions, and also the benefits of food. So another great place to access on Connect as part of this work. And then next slide, please, Carrie. Another program we have is called the Shine a Light on Stigma campaign. I'm not sure how many of you maybe have already joined this campaign, but really it's our ongoing efforts to break down those barriers, specifically around substance use disorders, but really it's a central strategy to looking at how stigma plays a role in everything we do when we're talking with our patients. And really, to be part of this program, just 4 simple steps. You can take the pledge, and then, and all those links are active here on these slides. Then you can click the link and learn more about stigma. And while this is, focus more on substance use disorder, I think there's a lot of parts of it that we can apply to, work with chronic disease management too, or just talking to patients overall about stigma. How do you use non-stigmatizing language? And then also there's a promotional media toolkit on that last bullet point. So that is all I have for today. Our next session, as I said, is March 14th, same time, same place. Let us, again, just checking if anybody has any questions about today or the materials for today or even upcoming sessions.
I just want to add, Jerry, we'll be sending out a link to today's slides in follow-up along with the recording. We don't have them to send out right this moment, so we will send those out in follow-up.
Yeah. So look for it by Thursday. Sometimes it doesn't know. I'm not going to promise it's going to get out today. So, but just so you know, it'll be coming out, either I would look for it like tomorrow or Thursday. And that usually, just so you know, too, it comes from Jenna Kornberg. So hopefully sometimes stuff goes into spam. That's why I wanted to tell you guys who to look for the email from. So if there's not any other questions, and I see we're almost at time, have a great day. And I forgot, I should have done this at the start. Happy Valentine's Day, everybody. And enjoy, hopefully, a safe and happy Valentine's Day tonight with the ones you love. Bye, everybody.